All right, so I'm here with Steve Smith. Steve, thanks for joining me.
Thank you for having me, Jared.
Yeah, well, let's break it down. Tell us a little bit about yourself. Just kind of introduce, and then the topic we're going over. This is going to be DIP joint pain or pain at the end of the finger, and you've written an article on this that we're excited to share and talk about. But yeah, introduce yourself to people that may not know you.
Okay. My name is Steve Smith. I'm a doctor of physical therapy. I have a orthopedic specialty certification as well as a strength and conditioning certification. PT is actually a second career for me. I got a bachelor's degree in marketing and sales management, but by the end of undergraduate studies, I did not care at all about the subject. So then I became a dirtbag climber,
Nice,
traveling
love it.
around
I love it how
selling.
that's a profession.
Yeah, that
Put
was my real profession. Yeah.
Yeah, put that on the resume. They're like, there's a
hmm
big gap of time.
that I did have to explain that to people. I did.
Yeah.
Yeah. But total like selling plasma in order to make rent because we didn't have jobs, just climbing. And then I decided to go back to school for physical therapy, and I've been doing that. Wow, it's almost been 10 years now, actually.
Wow.
Yeah,
Wow. And where'd you go to school for PT?
I went to University of Miami,
Nice.
um, and I'm from Florida originally, which you wouldn't think a rock climber would come from Florida, but I started climbing outdoors in northern Alabama in horse pens, so lots of slopers.
Yeah, definitely.
and and then I was traveling around mostly and living out west, so Red Rocks and Wyoming and Montana area, Colorado. Uh,
Awesome.
yep. And so now I'm in Huntington, West Virginia, right between the New River Gorge and Red River Gorge, about 2 hours in each direction.
You cannot beat that. So, well, I'm excited. We're talking. You wrote an article on the blog on DIP joint pain, and I'm interested to hear your thoughts on this. To go through everything. For those of you that are watching, via YouTube or online, Steve put together some slides as well that are actually quite good that break down this entire injury and process that can supplement as well the article. And for those of you that are listening, you'll get just as much out of this by just hearing what he has to say. So I'll share the screen for those of you that are watching, just so you can have a view here. And I guess my first thing to ask is, some climbers know what the DIP joint is, and they know all the joints in the body. And some climbers have no idea, like, what is the DIP? Can you explain a little bit about the anatomy of the finger and what this injury really is?
Sure. Really, the DIP is basically our initial contact with the rock. Um, I did this article because I had somebody come to me asking how they treated this, and actually, I've had this injury myself. And I think that a lot of people put so much emphasis on the finger flexors, and that we don't spend a whole lot of time looking at the other side of the finger. So the DIP, you've got several different joints in the hand. And in the long fingers, you have three different bones, three different phalanxes. And then in the middle of the hand, you have the metacarpal bones. And your DIP is the point where the first phalanx, the distal one, meets the middle phalanx. And then surrounding these bones, you have lots of ligaments and joint capsules and muscles and everything like that. But I think the ones that we're going to focus on, at least in this beginning part of the podcast, are your flexor digitorum superficialis and your flexor digitorum profundus. The superficialis comes up through the palm of your hand and it attaches into the base of your middle phalanx. And I've always found this fascinating. Where it attaches, it bifurcates, and your profundus runs underneath of it and then through that tendon to attach into the DIP. So, or the distal phalanx. So it's the only tendon that's crossing over that DIP joint. Um, so it makes you wonder how much force is going through that joint when you are doing a full crimp position, for example.
Yeah, and it's interesting, like you mentioned earlier, a lot of climbers come in, and I know you're seeing a lot of climbers as well. And I mean, it used to be all I would see would be climbers with pulley injuries. And now, and pulleys are, obviously the ligaments that keep the flexor tendons flush on the front of the finger. And now I've seen so many joint related injuries, and especially like the PIP, which is the middle joint, and the DIP, which is the end joint. And it's been interesting, just this kind of change and shift to more of these joint related problems. So I'm interested to see kind of your thoughts on it, and some other ideas that you have. But that makes sense explaining the anatomy.
Yeah, and I think that we'll probably hit on some of the reasons why we're seeing more joint related injuries when we go a little bit deeper into the discussion. So
Yeah.
next, sorry, go ahead.
Yeah. Well, yeah, I guess talk about the joint. Like that seems quite
Yeah,
important.
absolutely. So the bones are going to be, you have several different types of joints in the body, but the ones that attach your finger bones are referred to as a synovial joint. And so again, like we said, the DIP is that very first knuckle on your finger, and it consists of a capsule that surrounds the articular surface, and in the capsule there's a cavity. And this cavity is filled with synovial fluid, and that's going to act as a lubricant, but also a medium for bringing nutrients and waste in and out of the joint. Um, and so the outer surface of that capsule is referred to as the articular capsule, and that just holds the bones together. And then the inner surface is referred to as the synovial membrane, or the synovium, and this is what seals in the synovial fluid.
So I have to assume that, when your climber comes in, they have pain on the tip of their finger. It's on the back side of their finger, and they're coming in saying, this hurts. That you obviously would do some clinical assessments, but the first thing in your mind is this like capsulitis, synovitis. So, like, what's going on? Like, what's happening? To kind of describe that, and kind of how prevalent it actually is with climbers.
Well, it is one of the three most prevalent injuries in rock climbers, and it's going to make up about 6 to 10% of all climbing related finger injuries. And so, what we're talking about is synovitis or capsulitis. You can use the terms interchangeably. And it's basically a symptom of when that synovium or synovial membrane of the joint becomes inflamed. Um, so when we're looking at all synovial joints in the body, in active, healthy people, the most common cause of synovitis is just overuse of the joint. And we all know that climbers don't overuse their joints, right?
Not.
Not at all.
Yeah.
uh,
Pause.
Pause.
Yeah, especially on incline, like especially on like very inclined routes or overhung routes or small crimps or things like
or
that. No,
or
the joints have no stress at all.
no, or cracks, finger cracks, man.
True,
You're
so
sticking
true,
your fingers
right?
in and then twisting it. So not only are you probably you're doing almost like a side, like a crimp, right? And then you're adding a torsional element to it
And
for those
before
really
I
tiny rips.
actually learned how to climb cracks properly, I would actually just torsion, yank on my fingers, allow my feet to cut, and just like, slither my way up a
Mm-hmm.
route while I'm shredding my distal joints.
Yeah,
So,
yeah. I think that I had an incident like that happen with the first finger crack I ever climbed, but it was so cold out that I didn't even feel it. My fingers were
yeah,
just so numb.
the benefits of losing
Of
sensation
cold
in your
weather.
fingers.
Yeah,
Yeah.
absolutely, absolutely. But so most exercises are going to spread pressure over the entire cartilaginous surface. However, in rock climbing, that continuous gripping of holds, and more specifically using that full crimp position, where the PIP, which is that middle knuckle, is in hyperflexion, so it's flexed down all the way, and then your DIP is in hyperextension. It's going to cause one specific spot of that cartilage to become compressed. So right where your the tops of those two bones at your first knuckle meet you're creating this little flattened surface over time. And so stresses to the synovium can happen when the fingers are twisted into tight places, like we just said with crack climbing, or if you're just really using that crimp position a lot. And then microtrauma occurs in the area, which increases the production of enzymes, which irritates the synovium. And then this is going to produce more synovial fluid, and that's going to put more pressure in the synovium, causing thickening and increase in synovial fluid even more, leading to chronic inflammation, joint thickening, arthritis, bone spurs, and you can see it's just this big cycle. So you see like those older climbers, and they've got those big sausage knobby fingers, probably because every single joint in their hand has chronic capsulitis.
Yeah, and there's interesting thing that, some climbers have chronic capsulitis, osteoarthritis, and all their fingers are older, and they have zero pain. And Volker Schoeffel did a study on, it was actually quite fascinating, on youth climbers and tracking them over like 10 years, right? To kind of see the degenerative changes in the fingers. And as climbers, we all have these degenerative changes. It's interesting to me why some climbers get pain and some don't. Because you'll see climbers with gnarly fingers, right? They've been climbing for 20 years and they have zero pain. And then some climbers will come in single finger, blown up DIP joint or even the PIP, and that will be the one that generates pain. So I always find that interesting to try and distill down. But you have an interesting graphic, for those of you that are watching, of that like DIP hyperextension. And I think that one's really interesting because the edge that they're crimping on is a really thin edge, and it's an edge that only goes down to the first pad. And do you have any thoughts on if edge depth affects DIP capsulitis? Meaning, if you're crimping or even half crimping on like a 25 mil edge, versus a 10 mil edge, and your second pad, like your pad of your finger and then your middle phalanx, that kind of second bone in your finger, is supported by the board or the hold. Does that help limit or mitigate this injury, or does it not matter?
I mean, I think that's an excellent question, Jared. I would say logically that it would. I think a lot of this is going to come down to testing it out, right? And clinical decision making. It's something that we'll get into later on in the discussion of how do I return back to hangboarding? How do I return back to climbing? What should I look for? I can tell you, this is my hand, my finger, the finger that I hurt. And that's a 20
The one
millimeter.
that's showing on the screen.
The
right
one
here.
that's showing, yeah, the ring finger on my left hand. And I had swelling. I couldn't get my wedding ring off in the mornings. And my wedding ring is way down away from the DIP, but I had so much swelling that it was kind of going down my entire finger. But that was a 20 millimeter edge, and I would say that that's probably the most common edge to use for hangboarding, wouldn't you say? I mean,
Yeah,
I think everyone's got a 20 millimeter rail somewhere that they're probably starting hangboarding on, or at least on one of the hangboards that has a whole bunch of different holds on it. They're going to be a 20 millimeter edge on there somewhere. But yeah, like we said, it seems to be most common in the PIP and DIP joints, specifically of the middle and the ring finger. And I know you did a case study on someone who had it. PIP, was that the middle or the ring finger?
Yeah, it's PIP capsulitis of the ring finger.
Of the ring finger?
Yeah, and that it's I see it so many times in the middle finger, just because it's obviously the longest finger.
Yeah.
But they had a finger split where they would hang on the fingerboard and their pinky would just torsion outwards. And so the hypothesis, like the pinky would like rotate away only on that side from the ring finger. And so the hypothesis, like you look at them, the pinky rotated and torsioned and the ring finger did the same. And so the idea was, well, I think the mechanics of their gripping is probably playing a role. But these are interesting, so much like anthropometrics, the length of the fingers, like 2D to 4D ratio, like how long the second digit is compared to the fourth digit, all these components I keep seeing may play like a larger role than obviously you overload it with, with crimping and volume and intensity. But yeah, I'm nerding out a little bit about some
Well,
of those
I was
individual
gonna say, I mean,
differences.
I
Yeah.
think that people who aren't physical therapists might get a little bit bored with you and I
Yeah.
going into the weeds, but because I mean that's going outside of the detail of this article. But yeah, I mean that's why if this is really a big problem, you should seek out a PT or a clinician that knows the sport, because we'll probably know what to look for. I thought that the exercise or corrective exercise that you came up with, where they were kind of pinching the knotted rope between their
Yeah.
fingers while they were hanging, was pretty cool.
Yeah,
Um,
and I think you make a good point is see a medical provider. And obviously we're doctors of physical therapy, so that's who we will kind of promote, but see somebody who climbs. And there are so many details that obviously you won't go over in this discussion, but that may actually lead to this, even past the basics. So
mhm.
but okay, someone has this. They come in, they've been identified that they have this, DIP capsulitis. It's swollen, in the final joints in their finger. You overpress it, forward and back, and it hurts. You compress it and it hurts. And and it's stiff, right? And
Yeah.
that joint is quite stiff. All right, what's the rehab process? What should a climber do? What should they expect when they see a physical therapist?
Well, so let's go through the symptoms. You named a lot of them. Decreased mobility, we'll throw in there, and I want to go over why the ring finger specifically for this.
Mm-hmm.
If you look at the play of the joints, when you're in that full crimp position, you've got your middle knuckle all bent all the way, and then everything is pushing up on that DIP joint, on that fingertip. And if you look and you put your finger in that position and you press up on your ring finger, the fingertip, you don't have a whole lot of play in that joint. So you got more
Yeah, and
play in the other joints. And
what you're saying is if you take like your pointer finger and you extend it,
right,
there's a lot of motion. But if you
right,
take your ring finger and you try to hyperextend it or push it backwards, it just doesn't
exactly.
move as much.
Yeah. So those bones are hitting into each other pretty immediately. Okay. So the people who are possibly going to have this injury, and really all of us can. But if it's a newer climber who relies a little bit too much on a full crimp position, we're getting into it. We don't know the mechanics. You haven't started hangboarding or really working on technique or strength or anything yet. Those newer climbers can get it if you're just progressing the intensity too quickly. I did it working on, and I'd done this routine several times, but I did it working on a minimum edge hangboard routine. And then climbers who are more elite than the rest of us, a little bit more advanced, where they're working on routes that is like all tiny little crimps where they have to use this full crimp position. So all these people can develop these injuries.
Yeah, and it's interesting that you point out that there is that stiffness difference, on that fourth digit,
Mm-hmm.
versus the pointer finger, the ring finger versus the pointer, and all these kind of predisposing factors. So, all right, we've identified it. We know the injury. This is
Yep.
probably one of the easiest of climbing injuries to diagnose, right? Because it's swollen, back of the finger pain on the last joint, doing a lot of crimping. Okay, check. In addition to other things that you mentioned. So what's the rehab protocol? What do climbers do to make this feel better, to get back on track?
Sure. So initial acute phase, you got to kind of unload the area. Ice, relative rest, anti-inflammatories. You can kind of do gentle, easy massage for some of the swelling, and then I put joint mobility work, passive and active, but I would say still be pretty gentle with it. I would definitely not do any joint mobility work into extension, since that's what got us here in the first place. But kind of blocking that middle bone with the thumb and index finger of your opposite hand, and kind of moving that fingertip back and forth just to keep some of the active mobility. Um,
So you're kind of
and
isolating the joint.
isolating the joint.
You're
Absolutely.
putting your up like a from your other hand, your finger right on the joint, and then you're just moving that last joint in your finger
Right.
back and forth just to get a little bit of motion. I'm assuming motion is lotion, right? If you have some
Absolutely.
gentle movement, that's lubricating the joint.
Mm-hmm. And then long-term injury reduction is progression after that acute phase is going to be incorporating a really good dynamic warm up into your routine prior to exercise or hangboarding or climbing at all. I know you got a really good dynamic warm up that you created that's kind of full body,
Mhm.
but we're focusing more so on the fingers here, and hopefully you don't get too many emails for this. I feel like I always get in trouble when I say this, but static stretching is not going to the research is showing that it's not going to warm your muscles up, and it doesn't really uh, help reduce or prevent any injuries. So it doesn't mean that you can't do it, but but it's recommended that you do it kind of away from all of your exercise or climbing activity. And I think in your article, you actually said that static stretching caused the subject more pain. Am I wrong about
Yeah,
that?
and actually, yeah, good memory. So the article I put, it was on PIP capsulitis, and it actually caused him more pain because the static stretch he was doing was he was over pressing his joint into flexion,
Oh,
and so he was
okay.
actually, yeah, he was taking his joint and bending it as much as he could, and it was hurting the top of his finger where he had his pain.
Hmm.
And he was aggressively doing that because he had thought it was some type of pulley injury, and he just had to get his motion back. And
Right.
yeah, stretching the joint into the painful position aggressively in the early stage of capsulitis is probably contraindicated.
Yeah.
So,
I would agree with you on that based on my
and,
clinical judgment.
yeah, and I love the photos you have. If anyone's watching the video here of the different dynamic warm ups, there's tendon
Yep.
glides, there's grabbing a ball, there's like a rice bucket. I mean, it seems like just move the finger under some type of load progressively.
Right.
Is that
Right.
your thoughts on a dynamic warm up?
Absolutely. So dynamic warm up is getting blood to the muscles and actually warming up your joints and your muscles. I use the analogy of static stretching is like taking a raw piece of meat and pulling on it to cook it. It's not going to happen, right? So you need to do something active, isometric holds, or the rice bucket. I hope that any climber that's been in the game for a while knows rice buckets. And a lot of these rehab exercises may actually become your dynamic warm up once you are feeling better, right? Ball squeezes, tendon glides, rice buckets, all that stuff is good, easy. You don't need to kind of schedule time out of the day to do it. You can, if you have a desk job, you're sitting there with the ball that you're squeezing. Make sure you have a really deep bucket so that you're not getting rice all over the floor of your office or anything like that.
Yeah, I love the double bucket. I usually recommend people to get their shoulders out to the side, get two buckets of
Oh,
rice.
two buckets, like
Exactly. Yeah, get your
okay,
hands in there. No one ever does it, but just because it's a pain to get double, two different buckets. But
sure, sure.
anyway, all right. So that's the warm up. Get the finger moving, get some synovial fluid going, progressively get it warmer. I see you have something here about hangboard grip positions. What? Tell me about that.
So this is still kind of part of that dynamic warm up, or maybe starting to kind of figure out how to get back into hangboarding. And so if you have been doing hangboarding for a while, you're probably going to have to reduce the intensity and volume of whatever routine you're doing. There's so many routines out there. I'm not going to address any specific ones, but maybe you go down to 30 or 40% of your max, or 50 to 60% of your max. Uh, but you're going to want to probably start back using more of an open-handed grip or maybe a half crimp position if you can tolerate that. It's just going to depend. Um, and in regards to that open-handed grip position, that's obviously going to unload your DIP, at least the part that's hurting, the backside of it,
Yeah,
and
unload it
and
from hyperextending backwards.
unload it from hyperextension backwards. Exactly. And then what we also know about how these muscles are working is that being in that open-handed grip position, you're more evenly distributing load between your superficial and your deep flexor muscles. So you're actually, when you go into that full crimp position, you're dominating with your superficial flexor muscles. Okay, so you're almost not even using your DIP or your flexor digitorum profundus muscle, the deep one, because you've put it in a position where it can't do anything because it's going around this 90-degree bend at your middle knuckles. So when you're in that full crimp position, your superficial flexor muscles are dominant. they're pulling you into flexion. And then so all the weight of your entire body is pulling up on your DIP joint or pulling up on that distal finger tip. And there's no way that your little flexor digitorum profundus muscles are going to be able to withstand the force of your entire body pulling on them.
Yeah, and I can
So,
feel that. Like the second I go on a smaller edge on a fingerboard, I'm like,
absolutely.
nope, fingers are
Absolutely.
hyperextending, and that's the way it is. So do you recommend it all? I see you have open hand, half crimp, full crimp. As a dynamic warm up, what are your thoughts on almost going in and out of those positions while the fingers are on a hold? For example, your fingers are on a hold and now you're flexing all the way up, you're going down as almost like a loaded warm up, or would that cause more pain or discomfort? And I don't know if I'm describing this well, but I think if someone's listening, just imagine that your fingers are on a fingerboard and you're letting your hand open up into an open grip, and then you're slowly closing down and you're going into a full crimp.
So
What
almost
are your
like
thoughts?
like an isotonic, almost like finger pull-ups.
Exactly. Yeah, that's a good way
Okay.
to put it. Finger pull-ups, and they can be unloaded. What are your thoughts? Is that dangerous? Is that safe? Is that something that warms up the fingers, or is it like a little too much load?
I'm going to give you the answer that I give a lot of my patients.
It
I don't
depends.
know. I don't know. It depends.
Yeah.
It depends. I think that it is a. I think it's a logical way of thinking about it, and I think that you're right. Probably in the more acute phase, maybe not, right? But I have, since I injured and kind of was reassessing what I was doing, when I do my warm up for my hangboarding, I'm in a little bit more of a open handed position. And I'll do a set like that, and then maybe a set in like a half crimp, and then a set in a full crimp, and kind of cycle through them. And this is when I'm not hurt, obviously, and just kind of warming up in all those different positions. But
As like
it's
separate
separate,
like
yes,
bouts.
in
Yeah.
separate, yeah. So still isometric holds, normal hangboard type routine, but just different grip positions within each set of that routine. And I think that if you're not used to doing an open-handed grip, it's hard.
Yeah. A true open-handed grip.
A
I feel
true
like I'm
open-handed
slipping.
grip is hard.
Yeah.
Yeah, yeah. Because you got to align your fingers up, because all your fingers are different lengths and everything. So you got to figure out how exactly to do it, and all of our fingers are going to be different lengths, right? Um,
Yeah.
so, but also we want to address the fact is that it's not a situation where you should avoid full crimping all the time. Like that's an unrealistic thing, right? You should still start to reincorporate a full crimp position in your routine, because if you don't and then you use it,
Yeah.
then
You're
you're
not going to
you're not
train
going to be
it.
ready for it. You haven't built up that resiliency to do that full crimp position, because when you're out on the rock, you can't choose the holds. You got to be ready for any type of situation that comes up. So I don't want anyone to think that I'm saying avoid full crimp all the time at all costs with all your training. That is not what I'm saying at all.
Yeah. Well, okay. So we talked about the fingers. That makes sense. And we have the warm up. I mean, there has to be other aspects up the chain that you can kind of describe. You know, does the wrist play a factor? Does the shoulder? Does technique? Like, what are your thoughts on other areas outside of the actual fingers themselves contributing to this?
I think everything you mentioned could play a role in it for sure. I think that if you make modifications and still find yourself over dominant in a full crimp position, then you do need to kind of start looking elsewhere and seeing if there's something else that can be addressed. I think that on the next slide you've got a picture of someone chicken winging, and I think that we've all probably done this at some point in our climbing career. Um, and what people I think maybe don't realize is that finger and wrist extension will create a strength in finger and wrist extension is going to create a stronger grip. And I want to go through an example of how this might work. Is that people who have a spinal cord injury at C6 or above, they've lost the ability to flex their fingers. But if you watch them, they can still pick up certain items, right? And what they end up doing is they use what's called a tenodesis grip, where they kind of lay their hand maybe on top of a fork or something like that, and then they pull their wrist into an extension, and it causes their fingers to flex. So if you hold your hand out just completely loose with your fingers dangling, and then you just pull your wrist into extension, your fingers are going to flex. All right.
Yeah, people are kind of listening right now. Definitely try that. There's, you know, it's a crazy phenomenon that the second that you kind of cock your wrist back, your fingers curl inward.
Yeah. If you just keep everything nice and loose and passively let your fingers flex, that's what happens when you go into extension. So this is why when someone is climbing at their max and they get really, really tired, you start seeing them chicken winging because they're moving their wrists into more extension to try to grip down harder. But this is unfortunately going to put you into even more of a full crimped position. Okay. Now the picture is you know, an extreme situation. I think probably they
posed for it.
They posed for that. Yeah.
Yeah.
So
I love when people have bad mechanics and then they have some like brand in the photo. Like you can see there's like is that a Black Diamond?
Oh, is that? I didn't even know.
They should have like brand specialist screening for only, if you're going to wear our clothing, you should only be, you know, looking good and doing proper climbing technique.
Absolutely. So with this realization, I mean, everyone's doing hangboarding work and finger flexion strengthening and wrist flexion strengthening. So we want to look at the other side, is how do we strengthen some of these finger and wrist extensor muscles to help with that grip. And then I put this quote on there that I really, really like. To make the right contractions possible, the whole muscle chain matters, and the strength of this chain is limited by its weakest link. So if you are so obsessed with finger flexion, and I got to hangboard more to get stronger, and you're just not getting there, then it may be another link in the chain that is weak that you need to look at.
Yeah, and you know, I don't know how many climbers come in that their flexors are strong, especially for the grade they're climbing. And then I can break their wrist extensors manually with just like 3 or 4 fingers, right, on my side. And
Yeah.
so, yeah, the chain, it just seems so important to the entire puzzle, and especially, you know, relating wrist extensor strength to finger strength.
Right.
I think a lot of climbers forget that.
Yeah.
Yeah.
Yeah, and of course, you know, this could involve the shoulder or the core or whatever. We're going to talk about the finger extensors.
The big toe, like the flexor hallucis longus. That's like that. If someone has DIP joint pain, you got to go to the big toe because their technique, you got to get that inside edge to lock that in, goes up the chain.
Yep. The superficial spiral lateral line.
All right, love it. All right, pinch grip variations. You had this in the article, and I have it on the screen.
So let's go back one slide. Yeah, so these are kind of the wrist extension exercises I think that everyone is familiar with, where you have your forearm resting on a bench or a table or something like that, and you have a dumbbell, and you're kind of moving your wrist up and down. Okay. I think that's probably a good place to start, especially if you haven't been working this, or you know, if you're prone to lateral elbow pain. This is a good one because it's going to kind of reduce some of the compression of that tendon on the outside of your elbow. But you're going to want to have your elbow bent maybe 30 to 60 degrees from straight. You got your forearm supported by a bench or something, and you've got a dumbbell in your hand, and you're just extending to just a little bit past neutral. You don't need to crank your wrist all the way back. And you know, you give yourself a decent weight to where you're getting tired, and doing 3 to 4 sets of 6 to 12 repetitions. You can do this with a dumbbell or a kettlebell, whatever you have. I think that the only problem that I run into with this is, I know in the physical therapy clinic you have dumbbells that go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. But once you get past 10, then it's 15, and then 20, and then 25. And I mean, trying to do a wrist extension with a 25 or 30 pound weight is, you start running into problems there.
Yeah, I've actually had climbers with finger pain that have then had that issue. They've then done too much rehab exercise with too heavy of a weight, and then they developed actually wrist issues, you know, from the, you know, the overflexion the wrist kind of lowering down. So yeah, it's important. That's a good point you bring up, to be mindful of those higher weight progressions.
Yeah. Yeah. So once you get to the point where, maybe you're doing those, so those are called isotonic movements, where you have a weight and you're moving it. There's motion involved with it. Once you get to a weight that, it just starts to get too heavy to lift those up, because your extensors are always going to be weaker than your flexors unless you have some type of neurological issue. Then you're probably going to want to move on to isometric exercises, which is you're pulling or pushing against an immovable force. All right. And then you've got two different types of isometrics. You have yielding isometrics, which would be you're in that same position that you were doing the other exercise before. You're holding a super heavy weight and you're just keeping it from pulling your hand down. So you're using all your wrist and finger extensor muscles to hold that position and keep the weight from pulling you down. Or you can do overcoming ones where, and I'm going to try to describe what's in the picture, but you have the weight on the floor, really heavy weight on the floor, and maybe you have a sling wrapped around it and then some type of a handle to where you're pulling up, like you're trying to lift that weight up, but it's too heavy for you to lift. Do you have a better way of describing that, or did I do it
No,
right?
I think that's a great way. I mean, like if a physiotherapist is listening to this and they're not aware of the terms, it's the overcoming isometric is you're basically creating a little bit of a concentric force with isometric. You're shortening, where the yielding isometric is you're creating a little bit of an eccentric force, where you're like giving way. That's more for the physiotherapy audience. I think the way that you described it is very good for the for the climber audience. And if you're not watching this video, you should definitely check out the video, because on the far right of the screen is really where what Steve's describing, it really makes sense. Like you can see, like there's a wrist, a hand grasping a handle, an immovable object beneath, trying to extend back. And then on the far left and even in the center, there's a wrist with a heavy object that can lift against it.
Yeah. And when you're talking about programming for this, again, you can kind of get into the weeds. It depends on your goals. If you're working on strength or stiffness, you want your total time under tension being around 30 to 90 seconds. If you're working a little bit more on tendon density or muscle hypertrophy, then you want to extend that to 80 to 150 seconds. So you could do, for more high intensity, 5 to 15 repetitions, but for 5-second holds. So you're going to be able to do a pretty strong muscle contraction for 5 seconds. All right. But if you're wanting to work a little bit more on tendon density, then you're going to do a longer hold, which is going to reduce the intensity of it. So it's also going to depend on how, if you are having symptoms, how your symptoms respond to the pull or the intensity of it.
And then with pinch grip, is this you included this because because varying the finger position?
I love these. So this would probably be a little bit more advanced variation of loading your finger and wrist extensors. It is going to put a little bit more compression on the outside of your elbow because your arm is extended. So I think this is a good spot to say that it's probably a good idea to kind of cycle through pinch grip holds, and then the ones that we just talked about where your arm is supported and your elbow is bent. So like 4 or 5 weeks of one, 4 or 5 weeks of another, just kind of, cycling through, changing the different variations.
Just so you don't overload,
creating another overuse injury, right?
Get tennis elbow or lateral elbow pain while you're rehabbing your DIP joint. Yeah.
Mm-hmm. So with pinch grip, you can decide how wide of a pinch you want to hold. You take a couple 2x4s and you screw them together. You put an eye bolt on the broad side of it, and then you hang a weight off of it, and you're just standing there gripping either side of that block and letting the weight hang down, and you're holding it, and you will feel a noticeable amount of strain going through your extensor muscles with it. It's kind of amazing. To me, it feels good.
Yeah, I could tell you're like psyched on pinch gripping. I hate pinches. I'm like, this sounds terrible. But I think a really important thing is I mean, the DIP or the final digit is almost always
It's
flex in the
unloaded,
pinch
right?
grip. Yeah,
Yeah.
so you can really strengthen your finger flexors or lumbricals, the muscles that make that little sandwich grip,
Mhm.
and the extensors in your wrist all at the same time while absolutely not flaring up the joint, which is great.
Yeah, yeah, and I think that this somewhere I'm going to use the blanket statement of research tells us that that this actually it loads your extensor muscles pretty effectively to do this. So the three variations that I have on the PowerPoint, the one with the 2x4s, and I found that I needed to take some skateboard grip tape and put it on
I
either
saw
side of it.
that.
Yeah,
So you're talking about the image on the far left. You've got
the far
like
left. Yeah.
two cut, yeah, 2x4s, and then you have some type of friction surface.
Yes, just because my fingers were slipping off of when you get to a really heavy weight, if it's just wood, then your fingers are going to slip out of it. What I have recently started to use, which I really like, is I got a 4-inch knob hold from an online retailer,
Hmm.
and I put a eye bolt through it and then screwed a nut on so that I could hang
Oh,
the weight off of it,
interesting.
and so
And it's
that
just like
you've got like
ergonomically
this
feels
claw
good.
grip. Yeah. And then another one, if you want to do really low budget, is you just turn a kettlebell upside down and grab the bell end of it. But just like what I said with the dumbbells, is you're going to be limited by the weight and then just how big that ball is and how much you can get your fingers around it.
Yeah, but you could take another kettlebell and take a strap and lash it to it. And
You're
then you
absolutely
have,
right.
a bigger one. And then you have like a nice, perfect handle.
Yeah, you'll
Um,
have
you know,
everyone at your gym looking at you very weird.
yeah. I see that, yeah, you have that friction tape on it. Could you use like Crisco or olive oil or butter or something if you really wanted to,
Make
challenge
it
that?
hard.
Yeah, make it harder, get a
I
lighter weight, put some butter on there, see how it goes.
I guess you could. Yeah, yeah, I
Yeah,
guess you
all
could.
right.
The grip tape is pretty gnarly. I was training for crack climbing, and uh, I took wood and I made different
Oh, created
width
crack blocks.
cracks,
Yeah.
crack blocks, and I put the grip tape on the inside of it,
Uh-huh.
and I was doing like
No glove.
no gloves, strength endurance type routines in it. So I would be
Yeah.
on there for like 5 or 6 minutes, and it
Cheese
chewed
grater.
my hands up.
Welcome
I
to
found
Joshua Tree Granite.
yeah.
That's like that's great. What about hangboard recommendations?
Um, so hangboard recommendations, I am the type of clinician who I try to find an entry point no matter what when it comes to hangboarding or climbing with an injury. I very rarely tell someone that they have to stop everything completely because I think that that's what causes patients to not come and see a clinician is that they're not going to know their sport and they're going to say you got to stop doing it. But I think that in 99% of cases, you can find a way to do something where it's not hurting you and helping you. So, like we discussed before, you can do open hand positions. You can find a larger edge to hang on. You can hang on slopers, right? And then you choose a routine that you like to do. If you're really flared up, then maybe you're doing just like 5 repetitions, but you're doing more of a density hang where it's like 20, 30, 45 seconds on a sloper. I mean, that was what I was doing when my finger was really lit up. And I mean, you get a pump, a big pump, even on a sloper edge. You try to hold that for 45 seconds with your body weight or a little added weight, you'll feel it.
Yeah, and I
Uh,
think I think the challenge I sometimes run into, especially if you're doing these longer duration hangs, is some people can't actually hang that long because of their shoulders or because of
yeah.
some other body region. So yeah, I think always having that modification, obviously using a portable fingerboard at your side,
Hmm.
seems like that could be another option. Do you have any other hacks or ways to kind of like work around if someone just can't hang that long? Because it's a long, it's a
It is a
long
long
time.
time,
Yeah.
for sure, for sure. I personally have one of the Tyndek devices.
So it's a dynamometer, right? You
A
pull on one end,
dynamometer,
it gives you
yeah.
a number in your phone or
And they
your
have a
app.
great app, and I would pull as hard as I could, and I used my pain threshold as my stopping point. So I would come up with a max on my left hand for my pain threshold, and then I would work at a percentage of that using the 10 deck. Now, that not everyone's got that, but working on shorter duration holds, maybe you modify how many repetitions you're doing. We already discussed reducing the volume of it or the intensity of it. But I like telling people, monitor your symptoms. If they start to get to a level that's concerning, which is kind of around like a 4 out of 10 on that pain scale, or if you have pain uh, pain the next day, or increased symptoms the next day, then you need to back off a little bit. So that's a little bit more of a trial and error type of situation.
Yeah, and I think the fingerboard programs is really where the art meets the science. And
Yeah.
this is when it's like, if you're having a lot of difficulty figuring this out, maybe that's the time as well to see a physiotherapist, see a coach, see someone with some knowledge. Obviously, a physiotherapist would be the best because, well, it's our profession. But the other thing, I really do think that this individualization is so important. And I've seen that like small tweaks, just changing like the duration, the position, allows climbers to just keep training without flaring up that area. But this is probably, I could say, at least in my practice, this is like the crux of the rehabilitation, is just figuring out the right dosage that
Yeah.
won't flare up injury, but will allow progression.
Yeah, and it's really hard for you or I to sit on here and give an exact recommendation, right? It's that's impossible. You'd have to see the person and get feedback on how they feel. Do you need to offload weight? Do you need to keep your toes on the ground when you're hanging? There's lots of different variations that can be made so that you can keep up with your training, but not in a way that is making things worse or prolonging it.
Yeah, and then returning to climbing. This is my other crux, probably the bigger crux until Evan came around and wrote that
I
article on the
know,
blog.
man. Oh gosh, that was a great article and podcast, and I mean that's what I put here in regards to returning to climbing. I don't think that unless it's really bad, someone has to completely stop climbing. With this injury specifically, maybe you start working on slab more. Maybe you start climbing slopers or jugs just so that you're staying on the wall. And before, like I said with hangboarding, I would say don't let your symptoms go past a 4. You shouldn't be any worse the next day. Keep the intensity or volume down. But after hearing the podcast and reading Evan's article, I mean, I think I'm going to create some type of handout for
Yeah.
patients, or refer them to that article. I don't know if he did this specifically, but it seems that kind of that acute to chronic workload ratio, he was able to modify it to climbing, because I thought it was great. I think he did a great
Yeah.
job on that.
I mean, if anyone listening, if you have not, it's season 2, episode 1 with Evan Ingerson. But if you haven't like listened to that episode or haven't gone on to check out the ultimate guide to help you return to rock climbing, like I literally, that's saved me from trying to explain this all to patients. I'm like, nope, check out this article, go to this section, and then here's a PDF that kind of distills it down. So yeah, shout out to Evan for taking
Yeah.
a ton of time to put that together. So, is there any like kind of final words that you have, or kind of last thoughts on this DIP synovitis capsulitis diagnosis?
I think it's probably what you're going to hear a lot of physical therapists say is just try to use what we talked about here to see if you can manage it, but don't let it go on too long. I mean, the guy in your article, you said like several years, right?
I mean, it
He
had been
was
on
dealing
and
with it.
off,
Yeah.
yeah. And then he had a subacute episode when he came to see me. That, yeah, it's like stop it early on. This is one you absolutely should stop early on. That's good
Right.
advice.
Right. But it's also, as we stated before, is don't avoid a full crimp position. In this situation, you're going to have to stop using it, most likely, at least for a little bit, to unload that joint, and let everything calm down. But you don't have to stop everything completely. You just have to make modifications so that you can, at the very least, maintain your strength, and then start reintroducing that stress that caused your injury in the first place, so that you have that resiliency for whenever that situation presents itself in your climbing.
Yeah, absolutely. And anyone that has this injury or even has like some discomfort at the end joint of their finger, I really do think this podcast can help also preventatively, like, before it comes on, to almost go through. And the article that you wrote and created really has some great kind of tips and pearls. So how can people find you if they have questions, or if they want to see a physiotherapist that works with rock climbers? What's the best way to kind of get in touch?
Right now, best way is my email. It's Stephen, Stephen, .smith.dpt@gmail.com.
Great, and we'll get those linked in the show notes. And yeah, Steve, great having you on. This is great. This is like really detailed views, and plus we had a little bit of fun too, going back and forth. So great to see you.
Well, Jared, thanks for having us on. I think it's great that you're having PTs coming on and talking about this type of stuff.
Absolutely. All right, well, take care.
Thank you.